Dr. Winter, why do you think it's important for patients to be empowered in their DLBCL care?
A patient who is, I like the word engaged as well as empowered. I think it's important for patients to be empowered or engaged because medicine is very complicated and very fragmented these days. It's so difficult to be a patient and to be sick and not be able to, really take control. So patients need to be empowered. They need partners, advocates. It's a very sad comment on our healthcare system, but to be sure that things don't slip through the cracks. We, the providers, the hematologists, our job is tough, but we need a patient to partner with us. And so, for example, if you're a patient with diffuse large B-cell lymphoma as your diagnosis, make sure, was there a result for the fish? Need to make sure that doesn't slip through the cracks. Or if you are going for a second opinion or going to another medical center, make sure you have your records. Make sure. I really wish that every patient who had a scan of one kind or another, as they walked out the door, got a copy of that scan, a disc. That would make life so much simpler. But make sure that you keep your own records. And it's hard. And hopefully every sick individual has a family member, a friend, someone who's going to help them with this, because this is, it's very tough. But ask questions. Are there clinical trials I might be eligible for? Are there alternatives to the therapy you're recommending? These are all important questions to ask. And don't be afraid to say, with this treatment, what is the likelihood that my disease is going to come under control and be cured? I think you need to know that. And is there a difference between this treatment and that treatment? Do we know? Oftentimes we don't have the answer for the newer treatments, but we're hopeful. I just want to underscore the existence of a growing number of clinical trials that patients need to consider, think about. It's hard at the time of a new diagnosis to be struck with, not only the emotional impact of a new diagnosis and so on, and not feel well and so on, but just ask the question, are there clinical trials I might consider? So that's important. And also have optimism, because, the vast majority of patients, we do amazing things. And that's why it's so much fun to be a hematologist right now, is that we have so many new and exciting treatments. And, what's better than what's more exciting than to make someone, healthy again. So these are exciting times.